Did you know that sleeping with your mouth open could literally be shrinking your brain right now? Recent research has revealed something that may shock you. People over 60 who breathe through their mouths during sleep experience a reduction of up to 20% in brain tissue volume in regions critical for memory and cognition. Imagine this for a second. Every night, you sleep with your mouth open. Your brain is being deprived of the oxygen it needs to regenerate. Your neural cells are literally dying silently, and you don't even realize it. What scares me most is discovering that 80% of people suffering from premature cognitive decline have one thing in common. They've been sleeping with their mouths open for years, often decades, without knowing they were accelerating their brain's aging. Have you ever woken up with a dry mouth, as if you'd spent the entire night in the desert? Or perhaps you've noticed that you need to go to the bathroom several times during the night, constantly interrupting your sleep. These aren't just fleeting annoyances. They're alarm signals your body is sending, trying to wake you up to a much more serious problem than you realize. When you breathe through your mouth during sleep, especially after age 60, you're creating a cascade of devastating events within your body. Your brain doesn't receive an adequate flow of nitric oxide, a vital substance produced when we breathe through our nose, which acts as a natural vasodilator, improving cerebral blood flow. Without this essential compound, your neurons begin to function in survival mode, and over the months and years, entire areas of the brain begin to atrophy. What makes this situation even more alarming is that many people mistake the early signs of this brain deterioration for natural aging. Do you know someone who constantly complains about forgetting where they put their keys, can't concentrate on reading as well as they used to, or feels confused in situations that used to be simple? These aren't inevitable consequences of aging. They can be a direct result of years of sleeping with inadequate mouth breathing. Neurological studies have shown that people who maintain adequate nasal breathing during sleep significantly better preserve their cognitive functions, even in old age. The difference is so striking that researchers can identify simply by observing MRI scans which individuals have maintained healthy nasal breathing throughout their lives. But here's the part that really motivates me to share this information with you. Unlike many aging-related conditions, this one is completely reversible. Your brain has an extraordinary capacity for regeneration, even after you're 60, 70, or 80 years old. When you correct your nighttime breathing, you begin a process of neural renewal that can restore functions you thought you'd lost forever. Imagine regaining the mental clarity you had 10 years ago, getting back that deep, restful sleep that made you wake up truly refreshed, feeling your memory sharpening week by week. This is not only possible, it's probable when you understand exactly what's happening to your body and take the right measures. For years, I've seen people who came to me desperate, thinking they were developing early-onset dementia or Alzheimer's, when in reality they were suffering from something much simpler and more treatable. Imagine a woman who started getting lost in the neighborhood where she'd lived for 30 years, who could no longer do basic math at the grocery store, who was considering quitting driving because she felt confused in traffic. After identifying that she was sleeping with her mouth open and implementing specific techniques to correct her nighttime breathing in just 6 weeks, she reported, "It's like someone turned the light back on in my brain. I can think clearly, my memory is back, and the most amazing thing is that I wake up feeling truly rested for the first time in years." This transformation is no exception. It's the natural result when your brain once again receives the oxygen and nutrients it needs during the hours most important for its regeneration. The urgency of this information becomes even more evident when we understand that each night of inadequate mouth breathing represents a lost opportunity for brain restoration. During deep sleep, your brain activates the cerebral lymphatic system, a cleansing mechanism that removes toxins accumulated during the day. including beta amyloid proteins associated with the development of neurodegenerative diseases. When you breathe through your mouth, this natural cleansing is compromised, allowing toxins to progressively accumulate in brain tissue. It's literally like trying to clean a house with the windows closed and the ventilation systems turned off. Impurities simply accumulate with nowhere to go. If you recognized your experience in anything I just shared, I want you to know you've come to the right place. This channel was created specifically for people who feel their quality of life is being robbed by sleep problems that no one around them seems to truly understand. Here you'll find not just cold technical information, but practical solutions based on solid scientific evidence, explained in a way that anyone can understand and implement immediately. When you subscribe to this channel and turn on notifications, you become part of a community of people determined to recover not only their quality of sleep, but their quality of life itself. Each new video we publish features specific strategies, recent discoveries in sleep medicine, and most importantly, real stories of people who have successfully reversed problems they thought were irreversible. Your subscription not only ensures you receive this information firsthand, but also helps expand our community, reaching others who may be suffering in silence, thinking there is no solution to their problems. By clicking the subscribe button, you're taking the first step toward peaceful nights and days, filled with the energy and mental clarity you deserve, no matter your age. To fully understand how mouth breathing affects your brain, we must first understand what happens when you breathe properly through your nose during sleep. Your nose isn't just an air passage, it's a sophisticated filtration, heating, and humidification system that prepares each breath to optimally nourish your body. As air passes through your nasal cavities, it's filtered by thousands of microscopic cilia that remove bacteria, viruses, dust, and other harmful particles. Simultaneously, the air is warmed to ideal body temperature and humidified to protect your delicate lung tissues. But the most critical aspect for brain health occurs in the paranasal sinuses, where nitric oxide is produced, a compound that acts as a powerful vasodilator, dramatically improving blood flow to the brain. When you breathe through your mouth, this entire sophisticated process is completely bypassed. Cold, dry air enters your lungs, directly causing irritation and chronic inflammation. Without adequate nitric oxide production, your brain's blood vessels constrict, significantly reducing the flow of blood and nutrients to the brain's most important areas. During the 8 hours, you should be sleeping soundly and regenerating your neural cells. You're actually subjecting your brain to a subtle but constant form of oxygen deprivation. It's like trying to maintain a healthy garden by watering it with half the amount it needs day after day, year after year. Initially, you may not notice the difference, but eventually the plants begin to wilt yellow and die, just as neurons do when subjected to chronic oxygen deprivation. Imagine a person who had always been known for her impressive memory, able to recall names, dates, appointments, and details with enviable ease. At 65, she began noticing small lapses that she attributed to work stress. She would forget where she'd parked her car, had to make lists to remember simple grocery shopping, and began repeating the same stories to family members without realizing it. What she didn't know was that for over a decade, she had been sleeping with her mouth slightly open, especially during cold episodes that became more frequent with age. When she finally understood the connection between her nighttime breathing and the cognitive decline she was experiencing, she implemented simple techniques to keep her nasal passages clear and practice proper breathing during sleep. After 3 months, she said something that still moves me. "I feel like my mind has come back to me. I can concentrate on reading again. I remember the names of people I just met. And most importantly, I wake up feeling mentally alert for the first time in years." The impact of nocturnal mouth breathing goes far beyond simply reducing cerebral blood flow. When you breathe through your mouth, you completely alter the pH of your saliva and oral cavity, creating an environment conducive to the growth of harmful bacteria. These bacteria produce toxins that can cross the blood-brain barrier and directly cause inflammation in brain tissue. Recent research has established a clear link between chronic oral inflammation and the development of neurodegenerative diseases. It's a discovery that has revolutionized our understanding of how seemingly simple oral problems can have devastating consequences for the brain, especially in older people whose immune systems no longer function as efficiently as they did in their youth. The situation becomes even more complex when we consider how mouth breathing affects the physical structure of sleep. During proper nasal breathing, your body maintains a steady respiratory rhythm that promotes the brain waves associated with deep restorative sleep. When you breathe through your mouth, especially if there's some degree of airway obstruction, your brain must constantly work to maintain adequate blood oxygen levels. This results in frequent micro-awakenings that you don't even consciously notice, but which prevent your brain from entering the deepest stages of sleep precisely when most neural regeneration and brain toxin cleansing occur. What worries me most is encountering people who have developed a cascade of seemingly unrelated health problems without realizing that they all stem from the same root cause: inadequate breathing during sleep. High blood pressure that appears out of nowhere after 60, type 2 diabetes that develops even in people of normal weight, depression and anxiety that appear for the first time in life, memory and concentration problems that progressively worsen. Doctors treat each symptom separately, prescribing medications for each problem, when in reality a simple solution could address all of these issues simultaneously. When you correct your nighttime breathing, you're not just protecting your brain, you're restoring balance to your entire body. I need to share something that might resonate deeply with your personal experience. How many times have you woken up in the middle of the night with a completely dry mouth, needing a drink of water, only to discover you need to go to the bathroom an hour later, and then it takes another hour to fall asleep again? How many mornings have you woken up feeling like you'd been hit by a truck, even though you've been in bed for a full 8 hours? Have you noticed that your ability to concentrate during the day isn't what it used to be, that you need to read the same sentence over and over again to grasp its meaning, or that you forget what you went to do when you enter a room in the house? If any of these situations sound familiar, I want you to understand that you're not alone in this experience, and more importantly, that it's not an inevitable consequence of aging. Millions of people around the world are going through the same thing right now, waking up exhausted, functioning in survival mode during the day, thinking that this is how life is supposed to be after a certain age. If anything I've shared so far resonated with you, please leave a comment simply saying, "I wake up more tired than when I go to sleep," or "My memory isn't what it used to be." It doesn't matter how long you've felt this way. It doesn't matter how many doctors have told you it's normal for your age. Every comment you leave shows others that they're not alone, that there's an explanation for what they're feeling, and most importantly, that there's hope. Someone watching right now may be feeling lost, thinking they're developing dementia, when in reality they may be suffering from something completely treatable. Your comment could be exactly the encouragement they need to seek solutions. Together, we can break the silence surrounding these issues and create a support network where no one has to suffer in silence. One of the most fascinating discoveries of modern neuroscience is how our brain possesses an extraordinary ability to adapt and regenerate even in old age. For decades, it was believed that the adult brain was static, incapable of forming new neural connections or regenerating damaged cells. Today, we know this is completely wrong. Your brain produces new neural cells until the end of your life, constantly establishes new synaptic connections and can literally rebuild itself when we provide the right conditions for it to happen. The key is to understand that your brain needs three fundamental elements for this regeneration: adequate oxygen, quality deep sleep, and efficient toxin removal. All three of these elements are dramatically compromised when you breathe through your mouth during sleep. Neuroplasticity, the brain's ability to reorganize itself and form new connections, works like a muscle that needs to be exercised under the right conditions. When you sleep with proper nasal breathing, your brain receives the constant flow of oxygen needed to keep neural cells active and healthy. During deep sleep, which is only possible with proper breathing patterns, your brain activates repair mechanisms that repair damage accumulated during the day and strengthen the connections between neurons. It's literally as if your brain goes into full maintenance mode every night, provided you provide the right conditions for this to happen. Imagine a person who at 72 began having difficulty using the computer she had operated with ease for decades. She forgot passwords she knew by heart, became confused by simple programs, and began avoiding activities that required mental concentration. Family members began whispering about early signs of dementia, and she herself began preparing herself emotionally for an inevitable decline. When she discovered she was breathing through her mouth during sleep due to nasal dryness caused by high blood pressure medication, she implemented a simple protocol to keep her nasal passages moist and clear. 6 months later, she reported, "Not only have I been able to use the computer normally again, but I've learned new programs I'd never used before. My mind is more agile now than it was 5 years ago." This isn't a miraculous recovery. It's the natural result of providing the brain with the conditions it needs to function optimally. The cerebral lymphatic system, recently discovered by scientists, represents a revolution in our understanding of how the brain stays healthy. During deep sleep, this system increases its activity by up to 60%, pumping cerebrospinal fluid through brain tissue to remove toxic proteins, including the beta-amyloid plaques associated with Alzheimer's disease. This cleansing process only works properly when you're in true deep sleep, not the fragmented, shallow sleep that results from inadequate mouth breathing. It's like having a highly specialized cleaning crew that only works during the early hours of the morning, but requires specific conditions to do its job properly. When you breathe through your mouth while sleeping, you not only compromise the quality of your sleep itself, but also directly interfere with this brain cleansing process. Toxins that should be removed during the night progressively accumulate day after day, month after month, year after year. Initially, your brain compensates for this overload, but eventually, its compensatory capacity is exceeded, and you begin to notice the first signs: difficulty finding words, frequent forgetfulness, confusion in familiar situations, unexplained mood swings. The most tragic aspect is that many people interpret these signs as inevitable aging and simply resign themselves to it, when in reality they may be just a few adjustments away from regaining full brain function. The connection between mouth breathing and brain inflammation is another critical aspect that needs to be understood. When you breathe through your mouth, especially during prolonged periods like nighttime sleep, you create a dry oral environment that allows the overgrowth of harmful bacteria. These bacteria produce endotoxins that enter the bloodstream and can cross the blood-brain barrier, causing inflammation directly in brain tissue. Chronic inflammation in the brain is associated not only with cognitive decline, but also with mood swings, loss of motivation, and that feeling of brain fog that many people experience but can't adequately explain. What makes this situation particularly concerning is that brain inflammation is a silent and progressive process. You don't feel pain in your brain like you would if you had inflammation in a joint or muscle. The signs are subtle, a little more difficulty concentrating here, a little more forgetfulness there, a previously absent irritability. Many people attribute these signs to stress, age, or simply modern life, without realizing they may be experiencing chronic brain inflammation caused by something as simple as breathing through their mouth while sleeping. The good news is that brain inflammation related to mouth breathing is completely reversible. When you correct your nocturnal breathing patterns, oral endotoxin production decreases dramatically, brain inflammation resolves, and you can experience cognitive improvements within weeks. Imagine waking up one morning and realizing your mind is clearer than it has been in months, that you can concentrate on reading for extended periods, that your memory for everyday details has returned to normal. These improvements are not only possible, they're expected when you address the root cause of the problem. One of the most important aspects to understand is how different ages respond differently to improper mouth breathing. Younger people can often compensate for years or even decades without noticing significant symptoms because their repair and compensation systems still function at high efficiency. However, after 50, and especially after 60, these compensatory mechanisms begin to fail, and the cumulative effects of improper breathing quickly become evident. It's like driving a car with dirty oil for years when the engine is new and strong, versus driving the same car with the same dirty oil when the engine has already suffered from natural age-related wear. This explains why many people report memory and concentration problems appearing out of the blue after a certain age. In reality, the problem had existed for years, but the body was able to compensate adequately. When compensation mechanisms naturally decline with age, the cumulative effects become impossible to ignore. The encouraging part of this understanding is that you don't need to reverse decades of damage to experience significant improvements. Your brain begins to respond positively to changes in nighttime breathing within days or weeks. Imagine a person who had worked as a university professor for 40 years, known for his ability to deliver complex lectures without notes, quoting literature from memory and holding sophisticated academic discussions for hours. At 68, he began to notice that he needed more detailed notes, forgot the names of students he had known for years, and felt mentally exhausted after just a few hours of work. Colleagues began discreetly suggesting that it might be time to consider retirement. When he discovered that he had been sleeping with his mouth open for years, especially after having some teeth removed and altering his oral structure, he decided to implement techniques to correct his nighttime breathing. 4 months later, he reported, "I feel intellectually energized like I haven't felt in years. I've been able to give lectures again without detailed notes. My memory for names and academic details has completely returned, and most surprisingly, I have more mental energy at the end of the day than I did at the beginning a few months ago." The issue of mouth breathing becomes even more complex when we consider how medications commonly prescribed to older adults can contribute to the problem. Many medications for blood pressure, anxiety, depression, and allergies have the side effect of drying out the nasal mucosa, forcing the person to breathe through their mouth during sleep. It's a cruel situation where the medication prescribed to improve quality of life inadvertently creates a problem that can lead to cognitive decline. What makes this even more frustrating is that many healthcare professionals fail to make the connection between the medications they prescribe and the nocturnal breathing problems their patients begin to experience. There are several practical strategies you can implement immediately to begin improving your nighttime breathing, even if you're taking medications that cause nasal dryness. The first and simplest is to maintain adequate humidity in your sleeping environment. Dry air forces you to breathe through your mouth because your nasal mucosa dries out and becomes less efficient. A humidifier set to maintain humidity between 40 and 60% can make a dramatic difference the first night of use. Another extremely effective technique is nasal irrigation before bed using isotonic saline solutions. This removes allergens, bacteria and dried mucus that may be clogging your nasal passages, allowing comfortable nasal breathing throughout the night. Many people initially resist this practice, finding it uncomfortable or unnecessary, but those who implement it consistently report immediate improvements in sleep quality and morning energy. Specific breathing exercises practiced during the day can also train your body to maintain proper nasal breathing during sleep. Simple techniques like consciously breathing through your nose for progressively longer periods during daily activities help strengthen the muscles involved in nasal breathing and reduce the tendency to open your mouth during sleep. For cases of significant nasal obstruction or structural problems, there are simple, non-invasive devices that can help. Nasal dilators, external nasal strips, or mouth guards specifically designed to promote nasal breathing can be extremely effective, especially when combined with other strategies to improve nighttime breathing. It's important to understand that correcting nighttime breathing isn't just about implementing one or two isolated techniques, but about creating a comprehensive protocol that addresses all the factors that may be contributing to the problem. This includes evaluating medications you're taking, optimizing your bedroom environment, implementing proper nasal hygiene practices, and possibly adjusting your sleeping position to facilitate natural nasal breathing. The timing of these changes is crucial. Many people wait until symptoms become severely debilitating before seeking solutions, but prevention is always more effective than correcting already established damage. If you're beginning to notice the first signs of cognitive decline or sleep quality issues after your 60s, now is the perfect time to proactively address your nighttime breathing. Imagine what it would be like to wake up every morning feeling mentally alert and energized, able to face the day with the same mental clarity you had decades ago. Imagine regaining the ability to concentrate deeply on reading, to remember names and details effortlessly, to feel confident in your intellectual capacity regardless of your chronological age. These aren't unrealistic fantasies, they're typical results people experience when they properly correct their breathing during sleep. The journey to regaining brain health through nighttime breathing correction doesn't have to be lonely or confusing. This channel exists precisely to guide you through every step of the process, providing not only scientifically based information, but also practical support for implementing lasting changes. In the following videos, we'll explore specific techniques, practical demonstrations, and detailed stories of people who have completely reversed symptoms they thought were irreversible. If this video was helpful to you, if you recognized your own experience in something I shared, or if you simply want to support our mission of helping people regain their quality of life through better sleep, please like this video. Each like helps us reach more people who may be struggling with similar issues to yours. Share this video with family or friends who could benefit from this information, because sometimes we're the ones who need to alert our loved ones to signs they themselves can't clearly perceive. Subscribe to the channel if you haven't already, because we have much more valuable content coming, including specific protocols for different situations, analyses of the latest research in sleep medicine, and most importantly, more inspiring stories of people who have completely transformed their brain health. Let us know in the comments which aspect of this video was most revealing to you, or what specific question you'd like us to address in future videos. Your participation not only helps me create content more tailored to your needs, but also creates a supportive community where we can all learn from each other. Remember, no matter how long you've been facing these challenges, no matter how many people tell you it's normal for your age, your brain has an extraordinary ability to regenerate when you provide the right conditions. The journey to regaining your brain health begins with the next restful sleep you get, and we're here to support. you every breath along the way.